Welcome. Thank you for joining us here at SAMHI.online. We're going to introduce to you Chemically Speaking Two, our brief intervention program. My name is George Patrici. Thank you for logging on to SAMHI Online. Here you'll be introduced to a range of programs that will equip you to reach out to people who are struggling with substance abuse and mental health issues. This is a journey over the last 40 years. Initially 7 years in the drug scene, dependent on alcohol, cannabis, stimulants like speed, ice, ecstasy, cocaine. And over the last 10 years to follow, I had to work through the underlying issues and had a real heart to go back into the industry and make a difference. And over the last 24 years as a therapist, I've brought together what we call an integrative, holistic model that I'd like to introduce you to. Today, you're going to be viewing Chemically Speaking Two. And this brief intervention is actually designed to give you tools and resources to know how to walk side by side with a person to help them to get from A, as a drug user, struggling with issues, and you might be struggling yourself with various chemicals. This program that you're going to be participating in now is going to help you to understand the risks and the consequences and give you the resources to weigh up the costs versus the benefits. So at the end of the day, you have the ability to move forward. So let's journey together. And let's begin first of all with a bit of an overview. What are we covering today? Well, I'll talk about the integrative holistic model so you'll see how the body, the mind, the spirit all work together to interact. I'll also introduce you to the needs that drive human behavior so you actually understand what are the underlying issues that drive addictive behavior. We're then going to take a walk through the grief cycle so you see that many people that are struggling with substance abuse and mental health issues are carrying all sorts of grief. The loss of loved ones, the loss of limbs through accidents, all sorts of things happen to them. They carry grief and they get stuck there. Often they'll turn to chemicals as a way of masking these underlying issues. We'll then introduce you to the impact that chemicals have on our functioning, our health, drink and drug driving. We'll talk about the main drugs that you can bump into, alcohol, tobacco, cannabis and stimulants like speed, ice, ecstasy, cocaine. We'll then begin to finish this session with optimal health so that we can raise the standard from substance abuse, which brings harm to us, and we raise the standard to what we call optimal health. We'll then talk about, well, how do we move forward? We'll introduce you to the stages of change that Prochaska and DiClemente brought to us in the 80s. And then we'll talk about how to actually do the cost versus the benefits. And when a person puts up their hand and says, I'm out of here, I need to move on. Okay, great. Let's talk about the tripod of support, which is, of course, the counselling, the buddy. Now, the sponsor, by the way, is you. You're viewing this and you're going to be a sponsor. You'll have the tools to be able to get by someone's side and be their buddy, be their sponsor, so they can move through this journey. And then, of course, there are the meetings with Alcoholics Anonymous, Narcotics Anonymous. They're there to provide a community. And there are many other forms of supportive communities like church-based groups that people can be part of to be embraced by a community of love and acceptance. This is an overview of what you expect to see in Chemically Speaking Two.